Virtual reality is turning into something very big in the medical world. It's starting to become a means by which both patients and doctors are advancing their ability to handle the tasks of healthcare that are attacking us currently. Very recently, a lot of changes have been made to switch virtual reality to be used to help train doctors. The first virtual reality surgery was actually performed in 2016, but now they have made, very recently now, they have made these broadcasts available to anyone online in real time, so people can see the point of view of these procedures from the surgeon. This technology is being used to actually now train aspiring surgeons and surgeons to practice for future operations. Companies like Also VR and Immersive Touch are offering virtual reality solutions to train surgeons at home and to help them with their skills. In 2019, Harvard Business did a review in a study that proved that this is better than traditional training methods. They showed that VR-trained surgeons had a 230% boost in their overall performance compared to their traditionally trained counterparts. They also found the formers were also faster and more accurate in performing these surgical procedures. With a virtual reality camera, surgeons can also stream operations globally and allow medical students to actually be in the actual procedure when it's going on using their VR goggles. At Case Western University, they're being taught currently. They made this switch to help use such devices for human anatomy classes and to help revolutionize the medical evolution and education training. Dr. Brennan Spiegel, who is the director of the Health Services Research at Cedars-Sinai, said that it can be challenging for doctors to feel what it is like to have dementia or what it's like to have a family member taking care of someone with Parkinson's disease or to have a migraine headache. All these examples can be stimulated in VR to help doctors better understand what their patients are going through. So aside from just helping with procedures, this virtual reality is now being used to help doctors more fully understand what their patients are going through so they know better how to treat it. It also goes for patient care, where in 2019 there was a pilot study showing that patients undergoing surgery at St. George's Hospital in London had the option to use a VR headset prior and during the operation to see a calming landscape during the procedure. 100% of the participants reported that their overall hospital experience was improved by wearing the headset, where 94% said they felt more relaxed. Furthermore, 80% said that they felt less pain after wearing the headset, and 73% reported feeling less anxious. So they're also using virtual reality as calming mechanisms. They're using it kind of more cognitively as therapy for a lot of people. It's also being used to help women through labor pain. That's a recent thing they've started kind of trying to incorporate. Mental health patients with phobias, for instance, also find virtual reality very helpful, in addition to their therapists. Therapists are treating clients with many different disorders and struggles to help them face it little by little. So they're basically using these virtual reality systems to kind of ease their patients into exposure to the things that make them nervous, especially for PTSD. Also during physical therapy, they're starting to use virtual reality, which is showing shortened recovery times by making it easier for patients to do their exercises. This is because the virtual reality turns the patient's attention away from the pain, providing an observing alternative, and they basically have just the trainers help and motivate them and encourage them through the virtual reality. So overall, virtual reality is making a move into the medical field to help patients feel more comfortable, to help people gain more experience, and to just overall improve our ability to tackle the continuous things that are changing within the medical field and the things which are improving.